Let's talk about some of the diseases linked to vitamin C deficiency. Obviously, scurvy, we've been talking about that for the past 10, 15 minutes or so, but also bone loss. Your bones require collagen as the backbone, so to speak, of your bone. The collagen matrix is what pulls minerals in and allows your bone to harden, but the collagen is the part of the bone that keeps your bone strong and elastic and resilient. And so without vitamin C, you can actually develop bone loss. And this is also true, you can develop OA, osteoarthritis. It's the arthritis they generally doctors diagnose as a result of people getting older. They say, oh, you're getting older, it's normal to have the arthritis. But osteoarthritis can actually be caused by vitamin C deficiency as well. Cancers, and we'll talk a little bit more about that. Atherosclerosis. Remember, vitamin C helps to dilate the blood vessels, but it also acts as an anti-inflammatory in the actual vascular lining. Type 2 diabetes, high blood pressure, schizophrenia, all been linked. And we can thank the great work of Abram Hoffer, Dr. Hoffer. If you haven't read his work on schizophrenia, if you have a schizophrenic in your family or struggle with schizophrenia yourself, I strongly encourage you to go look up Dr. Abram Hoffer and his books on treating schizophrenia with high doses of vitamin C. Okay, let's look at vitamin C and disease. So I thought this was an interesting meta-analysis. This was recently published a few years ago. Vitamin C can shorten the length of stay in the ICU. This was a meta-analysis where they took multiple trials, and these are all human studies, folks. So a number of controlled trials have previously found that in some contexts, vitamin C can have beneficial effects on blood pressure, infections, bronchoconstriction, atrial fibrillation, which is in the heart, acute kidney injury. However, the practical significance of these effects is not clear. The purpose of this analysis was to evaluate whether vitamin C has an effect on the practical outcomes, the length of stay in the intensive care unit, and the duration of mechanical ventilation. They identified 18 relevant controlled trials with 2,004 patients, and here's what they found. In 12 trials with 1,766 patients, vitamin C reduced the length of the ICU stay on average by 7.8%. In 6 of the trials, orally administered vitamin C in doses of 1 to 3 grams per day reduced the length of ICU stay by 8.6%. In 3 of the trials, in which patients needed mechanical ventilation for 24 hours, vitamin C shortened the duration of mechanical ventilation by 18.2%. So given the insignificant cost of vitamin C, even an 8% reduction in ICU stay is worth exploring. So vitamin C, I mean, it's pennies on the dollar. There's no downside really to administering vitamin C, but the upside in ICU is definitely there. I agree. It should be explored more because the benefits are probably greater if they played with the doses. I thought this was also interesting. So the history of scurvy and the use of vitamin C in critical illness. So this was a review, and this is findings of human research trials and what they found in hospitalization. So here's what they found with vitamin C. Sick patients, critically ill patients taking vitamin C. It reduced heart damage, myocardial damage. It improved myocardial stunning. It reduced vasopressor demand, it reduced atrial fibrillation, and it improved microcirculation. In the lungs, vitamin C reduced the duration of mechanical ventilation. It reduced the risk for alveolar inflammation and pneumonia. Vitamin C inhibited bacterial growth. It increased microbial killing, it increased endothelial barrier function, and it improved antioxidant scavenging. In the kidneys, it reduced fluid demand and increased urine production. In the brain, it increased the protection of neurons from oxidative stress. It reduced infarct volume after ischemia. And then in the blood, it reduced capillary plugging and it reduced sepsis-induced drop of thrombocytes. So a lot of benefits there in patients hospitalized by taking vitamin C. Let's look at this next one. Prolongation of survival times of terminal cancer patients by administration of large doses of ascorbate. So this was actually a study done over a number of years in 2 hospitals in Japan, and what they found, the average time of survival after the date of designation is terminal, so these were, again, terminal cancer patients, were 43 days for 44 low ascorbate patients and 246 days for 55 high ascorbate patients. So terminal patients without vitamin C lived for 44 days, and high vitamin C patients lived for 246 days. 3 of the high ascorbate patients were still alive, their average survival being 1,550 days by the end of that study. Similar effectiveness of ascorbate was also observed in the Kamioka Kozen Hospital, where they found average survival times were 48 days in non-vitamin C patients and 115 days for high ascorbate patients. One of the high ascorbate patients was still alive, his survival being 215 days. In addition to the increase in survival times, the administration of large doses of ascorbate also improved their quality of life. I mean, if we're talking about a terminal cancer patient, I mean, we want their quality of life to be improved. And when we talk here shortly about vitamin C's impact on pain and its ability to reduce the need for opioid medications while still maintaining good pain management, this is part of that quality of life, because terminal cancer can become very, very painful. And vitamin C, it's hypothesized that vitamin C plays a role in opiate metabolism. Let's see here. Here's another, this is a big review study on nutraceuticals effective for musculoskeletal health and cognitive function. I just wanted to highlight here, this was a pretty broad review, and they were looking at different micronutrients, vitamins and minerals, to see if they had improvements, if there were improvements in both musculoskeletal health, so muscles and bones, as well as brain function. And so they found a total of 16 nutrients with good science showing that these nutrients played a good role in improvement of musculoskeletal health and brain function in older people. And of course, vitamin C was one of those nutrients. And so I just want to highlight that. There were other nutrients involved here, like omega-3, zinc, and vitamin K, and potassium, and B6 and B12. But vitamin C is what we're talking about today. So here's what I was talking about earlier with vitamin C and pain. So look here, epidemiological evidence has indicated an association between suboptimal vitamin C status and spinal pain. I showed you that earlier in a case study, but this is also true in general. Accumulating evidence indicates that vitamin C administration can exhibit analgesic properties, meaning vitamin C is a painkiller. That's what analgesic means in some clinical conditions. So surgical, trauma, infectious disease, and cancer patients are those conditions where there's good research. A number of recent clinical studies have shown that vitamin C administration to patients with chronic regional pain syndrome, also known as reflex sympathetic dystrophy, also known as dysautonomia, the chronic regional pain syndrome, it decreased their symptoms. Acute herpetic and post-herpetic neuralgia, so if you've ever had shingles, vitamin C administration reduces the pain. Is also diminished with high-dose vitamin C administration. So furthermore, cancer-related pain is decreased with high-dose vitamin C, contributing to enhanced patient quality of life. That's what we're just talking about. Herein we propose a novel analgesic mechanism for vitamin C as a cofactor for the biosynthesis of amidated opioid peptides, meaning vitamin C may be playing a role in producing natural endogenous peptides that act as opioids in the body. It is well established that vitamin C participates in the amidation of peptides through acting as a cofactor for peptidoglycine alpha-amidating monooxygenase, the only enzyme known to amidate the carboxyl terminal residue of neuropeptides and peptide hormones. Support for our proposed mechanisms comes from studies which show a decreased requirement for opioid analgesics. There's a lot of studies that show that when you put patients on higher dose vitamin C, they need less opioids to control their pain. And this is post-surgical. There are post-surgical studies. There are cancer patient studies that show this. Again, that high-dose vitamin C reduces the need for pain medication. Overall, vitamin C appears to be a safe and effective adjunctive therapy for acute and chronic pain relief in specific patient groups. What I see clinically a lot is people that have actual rheumatoid arthritis and it's not been very controlled by their medication. What we tend to do is we give them high doses of vitamin C plus quercetin. And there's a synergism, and when I say high doses, I mean 5+ grams per day orally. And with quercetin, it's 4 grams a day orally. And this combination, in my experience, seems to doesn't work for 100% of patients with rheumatoid arthritis, but for a large percentage of people that we see, I'd venture to say 40 to 60%, it works tremendously well at helping control their pain while you're trying to figure out what's triggering the autoimmune response. Okay, I pulled this from the Linus Pauling Institute from Oregon State University on vitamin C and mortality. And so there have been a number of studies that show that vitamin C supplementation actually improves or reduces the risk of mortality. In this study of 77.7 thousand adults with 5 years follow-up, they found a small decreased risk of total mortality. Another meta-analysis of 14 studies found an incremental 100 milligrams a day increase in vitamin C was associated with 11% lower risk of all-cause mortality. Another meta-analysis in 2014 of 10 studies and almost 18,000 women with breast cancer found a lower risk of total and breast cancer-specific mortality with high supplemental and dietary vitamin C intake. So there's good evidence out there on vitamin C improving or reducing the potential for death. So this study here on high-dose vitamin C for a patient with myasthenia gravis and Crohn's, what they found, people at the highest risk for vitamin C deficiency are those with inadequate intake. Of course, alcohol is going to deplete vitamin C, malnutrition, poor diet, psychiatric disorders. A lot of medications that are given to psychiatric patients can reduce or inhibit vitamin C. Restrictive eating habits, food insecurity, and then malabsorptive, GI inflammation. In this particular case report, a 26-year-old woman with Crohn's colitis. She also had myasthenia gravis, which is an autoimmune disease that affects the muscles through the acetylcholine connection to muscles. And she also had juvenile rheumatoid arthritis. I don't know why they're calling it juvenile when she's 26, but nonetheless. She presented with frequent bruising, epistasis, and excessive bleeding from small cuts, and who was found to be deficient in vitamin C. Her plasma levels initially normalized with oral vitamin C supplementation, but bleeding symptoms eventually returned despite high-dose oral supplementation with 2,000 milligrams daily. I would say you probably could have gone very easily with her 5,000 and could have potentially corrected that, but they opted to do intravenous supplementation to help her, and it did. I would surmise that because she had Crohn's disease, the inflammation of the intestines was causing malabsorption, the oral dosing of vitamin C that they were giving her. Here is another case report of scurvy, vitamin C deficiency masquerading as reactive arthritis. So you can see the petechiae here in the image. You can see some of the corkscrew hairs and the image blown up. But the points of this, these doctors, basically their final points were patients with scurvy often pose a diagnostic dilemma because their presenting symptoms can lead physicians down a laborious and costly road of unnecessary testing, including testing for vasculitic disease, infectious disease, and rheumatological workups. The diagnosis of scurvy is clinical and typically is based on signs such as perivascular hemorrhage, bleeding gums, anemia, impaired wound healing, and ecchymosis on the setting of vitamin C deficiency with rapid resolution with supplementation. Now, I think it's important to just highlight something here really quickly, and that is, how many of you have gone to the doctor recently or lately where the doctor didn't even look at you, or the doctor didn't do a physical exam. They just maybe sat over near you and, looked at the computer screen while you were talking and typed in some notes. These doctors are emphasizing the importance of scurvy being a clinical diagnosis. Here's what that means. You don't need to run a bunch of lab tests to diagnose scurvy. You just have to look at the patient. You have to look at their feet and look at their ankles and look at their skin. Look at the hair growing out of their arms, look at inside their mouth and the oral cavity to see, do they have swelling of the gums? It's a clinical diagnosis. You can make the diagnosis in the clinic without having to run a lot of tests. And vitamin C is so inexpensive and so easy to take. It could be a tremendous solution, again, without going down the rabbit hole of looking for, esoteric autoimmune disease. Okay. This was a study actually published in 1976 in the National Proceedings of Science, and or the Procedure of National Academy of Science, by Linus Pauling. Those of you that may or may not know who Linus Pauling is, he was a famous doctor, Nobel Prize winner, who was known for using high doses of vitamin C. And in one of the in-life interviews that he did was a reporter trying to pick at him, and he said, "Dr. Pauling, what about all the critics who say that taking vitamin C is so bad and so wrong?" And Linus Pauling's retort was, everybody keeps telling me that high-dose vitamin C is a bad thing, but here I am, an elderly man, still working in my lab, still publishing and still doing research. And a large part of it is because of the vitamin C. Well, this was a publication that he put out, and in his cancer patients, and you see cancer patients significantly depleted of ascorbic acid. And in our opinion, this demonstrable biochemical characteristic indicates a substantially increased requirement and utilization of the substance to potentiate these various host resistance factors, meaning that people with cancer need more vitamin C to help fight the cancer. So the result of a clinical trial are presented in which 100 terminal cancer patients were given supplemental vitamin C as part of their routine management. Their progress is compared to that of 1,000 similar patients treated identically but who received no supplemental ascorbate. The mean survival time is more than 4.2 times as great for the vitamin C group, more than 210 days as for the controls that were 50 days. So the people that didn't get vitamin C lived for 50 days, the terminal patients. The terminal patients who got vitamin C lived 210 days. I mean, think about that in terms of, how do you put a price on that? I mean, over 150 extra days of life at the end of your life, just with vitamin C, something so simple as vitamin C. Why isn't every cancer center in the country exploring this more? Well, the simple answer, in my opinion, is that there's no money in vitamin C. It's not patentable, so you can't, when you can't patent a medicine, it generally gets put on the back burner, and I think that's part of what's happened with vitamin C. I really like this story. This was actually a researcher who wrote in to the American Journal of Public Health in the 80s because she was reading in her books and reading her articles, as researchers did in the 80s before there were computers. It was all, dusty books and magazines, or rather journals. But what she was reacting to was the ink, the pollution in the ink in the journals, and it was affecting her eyes. And so she wrote in about her story. Anyway, this is part of it. Studies have been reported recently which suggest that there may be increased dietary requirements for ascorbic acid as a result of oral contraceptive use, smoking. Other reports have attributed depleted ascorbate levels to such diverse factors as stress, infection, collagen disease, aspirin use, and/or, keyword here, environmental pollutants. I mean, this is in the 80s, and of course, environmental pollution has gotten a lot worse since then because we're exposed to so many more toxic compounds and chemicals today than we ever have been. But we're also being exposed to radiative damage, from the use of 5G and 4G and Wi-Fi connections. I mean, they're so prevalent in our life today when they weren't in the 80s, hardly at all. So this doctor says, 2 years ago, my eyes began to tear and hurt when exposed to newsprint photocopied materials in the print in certain books, things which a college professor is in constant contact. When exposed to fresh newsprint, freshly Xeroxed materials, or exhaust fumes, my eyelids exhibited a spasm-like blinking so that they almost shut. This involuntary blinking made driving difficult and hazardous. Now, she went to an ophthalmologist and she received different treatment. She was tested for different allergies, and none of that really worked very well for her. She was aware that ascorbic acid with its antioxidant properties has a protective effect against various pollutants. However, had initially viewed vitamin C supplementation as unnecessary, as so many do. So many people think, oh, you know, it's just expensive urine. Considering my supposedly adequate dietary intake, nevertheless, at this point, because medicine had failed her, she decided to begin taking a conservative level of additional vitamin C, just 500 milligrams a day. Within a week, she noted progressive improvement. At this writing, still taking the supplement, I'm almost asymptomatic. So 500 milligrams a day, took a problem that her ophthalmologist couldn't help her with and resolved it. Seems like a simple solution. She said, it seems reasonable that for a variety of reasons, individuals may experience depleted tissue levels of ascorbic acid and thus could benefit from conservative vitamin C supplementation. Patient levels of ascorbic acid should perhaps be monitored more routinely, was her recommendation. Tests which measure cellular levels, i.e. white blood cell or leukocyte saturation, are probably more indicative of actual tissue reserves than serum levels. And then the note at the end, the editor's note, such individual observations have sometimes led to the generation of hypotheses and rigorous studies which serve to advance knowledge. So this is just her writing in. This woman was a doctor and a registered dietitian and a PhD. She was a professor of human biology at Wisconsin, Green Bay, just writing about her experience, fixing her eye problem with 500 milligrams a day of vitamin C. You can see here rheumatic manifestations of scurvy. This was 3 case reports in a large urban medical center over a 6-month period of time. 3 patients presented with symptoms including fatigue, purpuric rash, synovitis with effusion, so swelling synovial joints, anemia, and markedly elevated ESR, erythrocyte sedimentation rate, which is a marker for inflammation. They also had elevated C-reactive protein, which is also a marker, blood marker for inflammation. One patient presented with severe pulmonary hypertension. Careful nutritional history revealed a diet deficient in vitamin C. Interesting there, this phrase. Careful nutritional history. How many of you been to a doctor and they took a nutritional history from you? You know, raise your hand or comment below. It's my experience, the vast majority of patients I see have never had careful nutritional histories taken on them by the time they end up in my office. But nonetheless, nutritional history revealed a diet deficient in vitamin C. Examination revealed, examination. How many of you have not had an examination? Examination is part of the job of the doctor. Revealed hemarthrosis, skin finding characteristics of scurvy, and deficiency in vitamin C on lab analysis. Symptoms resolved with vitamin C supplementation. While scurvy is usually described in poorer countries, individuals who have psychiatric disorders or alcoholics with poor nutrition, it can occur even in otherwise normal populations in affluent countries, meaning it's not as rare as all the doctors are trying to tell you. Such patients often present to rheumatologists with rheumatologic symptoms, and awareness of the disease is necessary to make the proper diagnosis. So we've talked a lot about rheumatological disease and vitamin C. Let's talk a little bit about heart disease. In this case, right-sided heart failure and pulmonary hypertension. This was a 7-year-old boy with autism. He had a very restricted diet and presented with polyarthralgia, so joint pain in multiple sites. He had gingival hyperplasia or swelling, and he had pooling of the blood under the skin along with fatigue. His condition included pulmonary hypertension and right-sided heart failure, completely resolved with vitamin C supplementation. Pediatricians should have a high index of suspicion for scurvy in children with nutritional selectivity. In essence, this was another autism patient who obviously was peculiar about the diet. And be aware that it can manifest with cardiac symptoms. So vitamin C correcting right-sided heart failure. In this case study, effect of vitamin C supplementation on blood pressure. This is a meta-analysis of a lot of different trials. What they just see here, 29 different trials that met eligibility criteria. Here's what they found, in the trials. What they found was reduction, with vitamin C, a reduction in systolic and diastolic blood pressure. So with systolic blood pressure, almost a reduction of almost 5 points, 4.85 millimeters. And then for the diastolic, 1.67. And then conclusion, in short-term trials, vitamin C supplementation reduced blood pressure, systolic and diastolic both. Long-term trials on the effects of vitamin C supplementation on blood pressure and clinical events are needed. I agree. It's hard to get money to fund trials on nutrition because the people funding the trials can't patent the vitamin C and corner the market. It's part of why patent medicine is so blatantly disappointing and has disappointed the health of Americans, because really all the money goes to studying drugs that come at a consequence, but very little goes to studying the nutrition, which is what the cornerstone of health is built on.